Many people come to my office with inflammatory joint conditions like rheumatoid arthritis, and they're on all of their medications, they're still going through the trenches, they still feel terrible, and it's affecting their life. In this video, I'm going to give you the other side of the story beyond medications, the true bare bones nutrition and how you can use nutrition to help you with your inflammatory conditions, not just rheumatoid arthritis, but all the other inflammatory arthritises. And we're going to get started right now. Well, hello everyone, I'm Dr. Glenn Harrison and welcome to this week's segment of Why. This is where we take just a few minutes to answer some of the most common health-related questions and concerns that I see in my clinic every day. So the question today is how much can nutrition actually help you with inflammatory joint conditions? Well, I get a lot of referrals from rheumatologists now where they're able to get their patients so far and then that's it. And then they're still on all their medications and they're not able to improve the way they need to improve to function normally in life. And a lot of times nutrition is not looked at. And I work with thousands of cases like this. So I'm going to share the information with you and hopefully it can help you. Okay, the same strategies that I put in place in my clinic. So what is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune inflammatory arthritis, meaning your immune system targets your tissues just no differently than if your tissues was a virus or a bacterial infection. The immune system is confused. So this is an immune problem. First and foremost, it's not a joint problem. It's an immune problem that's creating a joint problem. So that's one thing that we have to remember. Okay, so that is it. So the goal is really with autoimmune management or rheumatoid arthritis management is to try to get your inflammatory levels down low enough so your immune system isn't constantly destroying those tissues, okay? Now, one thing with any inflammatory arthritis, whether that's psoriatic arthritis, because this applies, what we're talking about applies to all inflammatory arthritises, psoriatic arthritis, ankylosing spondylitis, juvenile rheumatoid arthritis, and then rheumatoid arthritis, and then there's a few others. But all of the strategies we talk about today is going to apply to all of them because those are all autoimmune inflammatory arthritises just affecting the tissues in a different way. But it's an immune problem and it's an inflammatory problem. So, focus on that. So the first thing you want to do with autoimmune anything, including rheumatoid arthritis, is control your insulin. This is widely overlooked, definitely by the medical community, but also the natural medicine model. So don't look at this. So how do you control your insulin? Well, you control your body's production of insulin by controlling your blood sugar. Now, the reason why you want to control your insulin is extremely inflammatory to your body. So if you have an achy right knee, add some extra insulin, your right knee will be more achy. If you have common rheumatoid hand pain, add insulin, you'll make that pain worse. Why is that? Well, insulin is inflammatory, and the more inflammation, the more you'll flare your arthritic problem. And to control insulin is produced by the pancreas quantitatively depending on how much sugar you have in your body. So if you're eating lots of sweets or foods, and I have other videos on this, foods that increase blood sugar, you have to make more insulin. So if you can keep your sugar low and steady, so, you will keep your insulin slow and low as well, and you reduce the inflammatory component of insulin. So that's number one. Okay. The second thing is avoid inflammatory foods. Now, I have videos on this stuff, so I won't go too far into inflammatory foods, but here's some simple things. Okay. Avoid all processed sugars. That is poison. That's pouring gasoline on your inflamed joints. Avoid all processed sugars. If you need something with sweet, use honey, maple syrup, or even dates to try to give something a little bit of a texture like that. Okay. Anything processed or natural sweeteners, stay away from those, the stevia and all of those. Those are marketed as health foods, and they might be a natural source, but they're in a concentration that you don't find in nature. So they still bring up blood sugar and your insulin and all of that. Maybe not as much, but just stay away from all that stuff. Eat real foods, okay? So processed sugars and sugars. The second thing is There's other foods that spike blood sugar. So grains, processed grains, turn into sugar in your bloodstream. So you can have massive sugar spikes when you eat breads and cereals and muffins and all that stuff. All that stuff will just spike your blood sugar. You'll dump a bunch of insulin and you'll flare your joints up. So stay away from that stuff as well. Also, I recommend avoiding dairy. Dairy is inflammatory to some extent to everyone, animal dairy. I'm not worried about the dairy mimics, the almond milk, cashew milk, all that stuff that we have. Just make sure there isn't a bunch of extra sugar added to them, okay? Because dairy is inflammatory to joints, very, very inflammatory to joints. So then there's a third thing. Now the third thing, everybody likes running to the third thing. Third thing is supplementation. There is no supplement that fixes an inflammatory condition. All it does is help. So focus on your lifestyle. That takes work, but that's where your benefits are going to come from. Secondary, slide into these supplements. Now these are 5 that I like, okay? 1, turmeric, high concentration of turmeric. All this stuff should be high quality. Don't buy anything low quality. Supplements aren't regulated like many other things are. So you don't really know what you're buying unless you buy from a reputable source. So high concentration turmeric, around 250 milligrams 2 times a day. That's one thing. Second thing, resveratrol. Resveratrol is another very powerful antioxidant. I also recommend about 250 milligrams 2 times a day. Third one is the most powerful antioxidant known to man, and it's called glutathione. I recommend S-acetylglutathione because you can actually absorb more of it. And I also recommend 250 milligrams 2 times a day. Okay, so those are anti-inflammatories, but don't ignore fish oil. The nature's true anti-inflammatory is fish oil. The vegan sources don't have the same effect. And high quality omegas, you're going to want anywhere between 3 to 4 grams a day spread out. And then vitamin D. Vitamin D plays a significant anti-inflammatory and immune modulating effort. It's called a hormone. So what you want with vitamin D, you want to know where your numbers are, so do your testing, but don't accept this bottom end what medically normal is. You want your vitamin D levels between 75 and 100, with the standard conversion or standard measuring system, imperial. I don't know it in metric, but what you could do with vitamin D if you're not testing, most people, it's fine to do 4,000 international units per day or 5,000, 4 to 5,000 international units of vitamin D a day. So that covers supplementation, that covers lifestyle, but here's a couple bonus pieces that you can do. An important thing to know about these inflammatory arthritis is with time, your joints start closing in. They get tighter and tighter and tighter. And you probably know this. The less movement, the worse they are, but then too much movement causes problems as well. In the morning, things are worse because everything's stiff. Here's a few things you can do. I highly recommend a stretching routine. Now, 10 minutes of stretching 3 times a day. I don't recommend long durations of stretching, but more shorter durations, more frequent, keeping us limber. The more you can get those joints moving and those muscles moving, the more you reduce the inflammation in the joints. It's very powerful. I can't say enough about that. Yoga or just your own stretching routine. Find something that works for you that doesn't irritate you. So that's stretching routine. The second thing is Epsom salt baths. Epsom salt baths, you can really get a lot of this mineral into the tissues and hydrate the tissues, and you can actually get tissues to move better. An Epsom salt bath every day or every other day, 20 to 30 minutes. Okay? So if you put all of these things in, hold the line, in 30 days, I can guarantee that there will be improvement in your inflammatory joint conditions. Okay, so I hope that was helpful. I have lots of videos on all of these things. If you need help with this, I'm very versed in this world. You can also click the link below. You can schedule a call with myself. We can see if we can help. If we can, we will. If we can, we'll point you in the direction so you can get the relief you need. With that being said, I'm Dr. Glenn Harrison. I look forward to talking to you in the next one. We're going to answer the why to another health-related question. Have a great day.